In this section, I'm going to speak about the main lines of intervention during an outbreak. What are the objectives of an outbreak response? We need to reduce mortality, and we do that doing a proper case management of patients. But we also need to limit the spread of the disease, and we will do that putting in place preventive strategies. So these are the lines of the intervention. All of them needs to be put in place in a synchronized way, and all of them are very important. So we have coordination, surveillance, case management, preventive activities, and community engagement and health promotion. We will explain one by one. Coordination. What does that mean? It means that as soon as possible in an outbreak declaration, there's a need to implement a crisis committee. This crisis committee needs to have different representatives coming from the Ministry of Health, from the reference representatives of the hospitals and laboratories, from the programs of immunization, administrative representatives, and also the medical humanitarian actors in terms of local or international NGOs and other agencies, enabled to get together and be effective in the response of the outbreak. A budget needs to be allocated for the intervention, and most important is to monitor the trends of the epidemic and see the different strategies and adapt the strategies according to the results of this monitoring. So all the efforts needs to be together, distribute the tasks between the different actors. Everybody needs to know who does what in order to be effective in a collective way. And for that, we need to have a surveillance system in place since the day one of the epidemic. So we need data collection put in place, harmonized so that everybody uses the same case definitions to report the data, to analyze it, and to understand where are the transmission areas and which are the high risk groups to be able to make decisions in terms of where to intervene and to who do we target the intervention. Laboratory surveillance is also very, very important because we need to know the proportion of diagnosis and confirmed cases to see the trends in the epidemic as well. And of course, for each infected case, we need to put in place also in different diseases active contact tracing. So to trace the transmission and what is happening in the communities. And for that, I would like to put you a video, which is an example and shows very well what is contact tracing and how does it work in the pandemic of COVID-19.
COVID-19 continues to spread around the globe. You can help stop COVID-19 by participating in contact tracing. How does contact tracing work? Contact tracing is a system that has been used for decades to stop infectious diseases. A contact is anyone who has had direct physical contact or was within 1 meter for at least 15 minutes with an infected person, even if that person does not have symptoms. This applies to anyone who has had contact from 2 days before a person gets sick until 14 days afterwards, or from the 14 days when an asymptomatic case tested positive. Once you are confirmed as a contact, you will be asked to go into quarantine, which means to separate yourself from others and to monitor your health for any signs of illness. The monitoring ends on the 14th day from your last contact with the person infected with COVID-19. Quarantine can take place in a special facility outside of your home or at home if you can stay separated from family members. Why 14 days of quarantine? It can take from 1 to 14 days from contact with the virus to develop symptoms. During this time, you should stay in quarantine and monitor symptoms and follow instructions given to you if you become symptomatic. Without contact tracing and quarantine, the virus will continue to spread. This leads to more people becoming sick and infecting the most vulnerable. By identifying and limiting contacts of people infected with COVID-19, the virus stops spreading and the community stays safe. To break the chains of transmission, we all need to work together. If you become sick with COVID-19, stay away from others. Follow the recommendations of your medical care provider and share the list of people who you came in close contact with. With your help, we can prevent further spread of the virus and save more people's lives. By acting together, we can break the chains of COVID-19 transmission.
Then, following with the lines of intervention, we are focusing now in case management. What does that mean? We need to try to diagnose and treat the maximum number of cases that are in risk during the epidemic, but the access to treatment needs to be free. The referral system is related to the connection from the communities to the primary healthcare level and the hospitals and the other way around, so that all patients have access also to the different levels of care. The referral system is the ways that the people come from the communities to the hospital by bike, walking, by motorbikes, by ambulances, adapted to the geographical and different contexts and access. So we need to establish with the communities what is the best, and the ministries of health and the authorities, what is the best and best way to have a referral system effective so that they can access to the treatment of the different diseases. Needs to be decentralized, the treatment. As much decentralized means that we are closer to the patients in the villages. The closer we are for an early diagnosis and treatment, the less evolution to severity and mortality in the communities as well. So if we have very many different centers in the different villages that can cope with mild cases in the community, this will reduce the overwhelming hospitals packed with a lot of patients depending on the disease. And this has also been seen in different outbreaks. Patient isolation is going to depend also of the disease. For instance, Ebola patients need specific treatment centers to be isolated, same as cholera treatment centers. For instance, in malaria, you don't need to isolate the patients because it's not transmitted from human to human, it's transmitted through mosquitoes. So it's better to put mosquito nets under the beds than isolating patients in malaria outbreaks. In terms of human resources, we need adequate number of staff, not only in number, but also in qualification. So they need to be trained, they need to know the guides and the protocols, and they also need to be supervised. And of course, we need to ensure that all supplies of material, lab, tests, and treatments are in place so that the staff can cope with a very big, huge amount of patients at the same time. Now, for community engagement and health promotion, this is one of the priorities as well if we want to be effective in the intervention. Why do we have such a priority? We need to put these activities in place immediately after the outbreak is declared, the same way as the surveillance system and the case management. The diseases normally often causes fear. They misunderstand what is happening and they distrust sometimes international aid workers. So it can lead to security incidents. So the community need to know what is happening in their environment. We need to explain them what the disease is about, how it's transmitted, and how do we do the active contact tracing. And they need to be involved and they need to understand why are we doing all the actions in place, like the preventive strategies, vaccination campaigns, case management, mosquito nets distributions. If we don't do health promotion activities explaining the signs and symptoms of the diseases, if we don't explain them what activities we're performing and at which level of care we're present, and that the patients will have free access to healthcare, if we don't do health promotion and we don't engage the communities in the intervention of the outbreak, then we will not have an acceptance to be able to do the deployment of activities, and we will not reach the goals of reducing mortality and limiting the spread of the disease. And then the preventive activities need to be also in place, and we are talking about mass vaccination campaigns, vector control measures, for instance, for transmission of mosquitoes. We need to put vector control activities in place. Also, water, hygiene, and sanitation activities are essential in different diseases, and pharmaceutical prevention, which are drugs that we are going to provide to prevent specific diseases in different outbreaks. This is an example of a mass vaccination campaign that was done in different areas of Nigeria. The target population was from 2 to 30 years old, which is normally the population affected by this disease. And we need to prioritize the areas of high population density and where population centers have more than 8,000 inhabitants. This is when we decide which is the target population for a mass intervention, and needs to be really well prepared with everything in place, with all the resources and all the training to be effective. This needs to be also coordinated with the authorities. And the idea is that we need to do these mass vaccination campaigns as soon as we detect some cases in the hospital. Because if the disease in meningitis, if the outbreak is happening more than 5 weeks or 7 weeks, then we will not have such an impact, and therefore all these resources allocated will not be effective. We need to do these mass vaccination campaigns as soon as we can, before the rain comes during the dry season, and ideally when we detect the first cases. Examples of water and hygiene and sanitation. It's very important to focus in ensuring safe water, both in quantity and quality, to promote hygiene conditions and practices. Also, the safe burial and funeral practices are essential in diseases as infective as cholera or Ebola. If we don't do these practices, we will have a huge transmission in the communities. And of course, the wastewater disposal and the excreta disposal needs to be also all the activities put in place to reduce the infectivity and the transmission. I'm going to ask you an exercise. You will need to choose the correct preventive strategy that should be implemented in the following epidemic diseases to limit the spread of them. Exactly. Vaccination can be implemented in Ebola outbreaks. This is an experimental vaccine, but it's done as a ring vaccination, only protecting the people that was in contact with the infected patient and the first line workers and the drivers and everybody that is in direct contact with one of the patients. In meningitis and measles, we can do mass vaccination campaigns. Unfortunately, for COVID-19 and malaria, we don't yet have an effective and safe vaccine nowadays. We hope we get them in the future. Then what some activities can be implemented in Ebola and meningitis and malaria? Vector control applies for malaria, the same as pharmaceutical prevention, and of course, infection prevention and control measures with universal precautions and additional precautions will be put in place systematically in all of them. And to finalize the section, I would like to share with you a video of WHO responding to Ebola.
Ebola is a disease that knows no mercy. This man is one of many affected by the outbreak in Guinea. But there are teams from around the globe who are on the move or on high alert to contain this current outbreak. Treating the disease is complicated because it's rare, it's contagious, and it's deadly. This is the first time Ebola has been found in Guinea. An added complication is that the disease is not only present in several remote areas in the country, but there are also numerous cases and deaths in the capital city of Conakry. The World Health Organization has been managing Ebola outbreaks since the 1970s. Once the disease has been reported, it triggers a global response. The IHR, International Health Regulations, provides a global framework for a collective effort in support of the outbreak response. Communication between WHO HQ, the Afro Regional Office, and the WHO Country Office in Conakry intensifies. The Global Outbreak Alert and Response Network, GORN, and other partners are alerted. Some contribute financially, some contribute supplies, others head to the outbreak site as logisticians, doctors, epidemiologists, or trainers. With their support, WHO is constantly optimizing response strategies. Teams meet daily to plan and coordinate activities on the ground and to identify challenges that need to be addressed. Some work in hospitals, some track the disease spread, and others work in the community with families. They are also confronted with the devastating news that the disease has been confirmed to have crossed Guinea's national borders into Liberia and has the potential to spread even further. Throughout the country, warehouses are moving supplies and materials. Experts are mobilized for contact tracing. Intensive care units are set up. Local staff are trained in the use of PPE, personal protective equipment. At the same time all these activities are happening, WHO is in constant contact with the Ministry of Health and many other international organizations in order to assure a smooth and productive response. A special communications team consisting of members of large national and international organizations is responsible for informing the public about ongoing efforts. A public service announcement shows how to stay safe. It's being broadcast in French and 6 local languages. Video footage of outbreak activities has been uploaded and has been used by television stations around the world.
World Health Organization, together with other partners.
The single goal of this immense response effort is to save lives. Its consequences will be felt individually, nationally, and beyond Guinea's borders. We can't do this job alone. We need support from others at all levels of the outbreak response. Together, we will move closer to making this Ebola outbreak in West Africa a thing of the past.
So this is the final slide of the main lines of intervention during an outbreak. I hope you understood that outbreak responses needs very many lines of intervention if we do things properly, coordinating all the actors, putting in place surveillance systems, doing properly case management, preventive activities also to reduce the spread of the disease, and community engagement and health promotion, then we will have a very effective response and we will reach our goals, which is reducing the mortality and reducing the spread of the disease. Thank you for your attention. This is the end of the section.